Thank you for tuning in to this week's episode where we'll be discussing eyelid rejuvenation, all right here on Aging Gracefully on Suncoast FYI. Dr. Sessa joins us this week to discuss eyelid rejuvenation. And welcome back.
Thank you.
Nice to see you again.
Nice to be back. Yeah.
This week we're going to talk about eyelid rejuvenation, and that entails eye lifts.
Yeah.
And skin removal comes along with that, right? You don't just put the eyelids up with.
Right. Sometimes it does. Yeah. Sometimes it does. Sometimes it doesn't. One of my favorite eyelid rejuvenation procedures is just removing a little bit of fat from underneath the eyes. Mm-hmm. And, because sometimes, you look in the mirror and you see puffiness, or, who doesn't have some puffiness under their eyes, right? So a lot of times that's fat falling out. We have ligaments around our eyes, and as we get older, they loosen. And as they loosen, the fat that sits under your eye starts to push outwards. Mm-hmm. And a lot of times it's very simple, no scars on your face. I'm able to sort of remove some of the fat that's pushing out.
Okay.
And then I use the laser that I rejuvenate skin with to laser over the skin on the lower eyes.
Okay.
And that has a skin shrinkage effect. Okay. So rather than doing surgical procedures where I'm cutting skin, removing skin, contouring muscle, removing fat, I can get the same result with much less surgery. So it's a much more conservative way to treat the lower eyelid, especially if you have loosening of the ligaments around the eyes.
Which everybody does when they get older.
That's right.
So that would be for the lower part of your eye. What about the upper part?
Yeah. So as far as the upper eye goes, a lot of people sort of come in and say, well, I have the skin hanging down. Some might even end up at eye doctor offices saying that they're having difficulty with visual field loss. And that's important because if you're driving, you need all the visual fields in order to drive safely. So if that's the case, the standard upper eyelid is done where you can remove the excess skin, heavy eyelid look. We make a very curvilinear incision hidden inside when you close your eyes. You can't see it when your eyes are open. And you remove a little bit of the excess skin, you remove a little bit of the excess muscle, and then it's all closed together. Very, very mild procedure, very low risk, very little bruising. 2 to 3 days at most of some mild recovery. But most of these procedures are very, very well tolerated, and they make the world of a difference. If you look at studies, when they say what ages you the most when you look at a photograph, the two things are your eyes and your skin. Those are the two things that tell your age, other than your hands, if you have sunspots all over your hands. But if you think about that, that goes hand in hand with, if you look at a list of the 5 most common cosmetic procedures performed, eyelids are always one of the top 5.
One of the top, sure.
Yeah.
Now, again, downtime. What kind of downtime is there? And again, when I say downtime, I mean that's recovery time. But how soon before you may actually want to be seen in public after you have something done?
So, typically, anytime you have any injury, whether that's surgical injury or you fell down and bumped your knee, you're going to have 3 days of some swelling. Generally, at 48 hours, the second day, is the greatest amount of swelling, and then after that it goes down. So typically 4 days, 5 days. By that time, most everyone, the swelling has reached a point where it's not unsightly, and you can be free to go out. The nice thing about eyelids is you can wear eyeglasses or sunglasses.
Right.
So you not only look cool, but you're the only one that really knows you look better underneath your glasses.
Yeah, great. Now, all of these procedures that you do you do these in your office? Do you do them in a hospital? And how is that all taken care of?
Yeah. So, great question. So, all of the cosmetic procedures that I perform, whether it's facelifts, eyelids, breast reductions, tummy tucks, they're all done in my surgical suite, in my private facility. So I have a private surgical facility within my office. That's quite large, actually. And this is regulated by the Florida Board of Medicine, which is a regulatory body. Operating in an outpatient surgery center in the state of Florida is very difficult. It's wrought with regulation. It's not anyone can just hang up a shingle and say, I'm going to start doing surgery tomorrow.
Right.
There are procedures, reams of paperwork that are necessary. Once a year, somebody from the federal regulatory body comes to my office, looks through all of my procedures, looks through my facility, makes sure that it's at the highest standards of care. So rest assured that I have the same standards that you would have in any ambulatory outpatient surgery center and or hospital. The only difference between my facility and a hospital is that the hospital is associated with a hotel, if you will.
Right. Right. Well, that's great. I mean, that's so much more personable too. I think going in and having that experience with your patients. Well, again, thank you for being with us, and we'll see you next week.
Thanks again.
All right. Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. A new guest joins us in the studio today from Therapeutic Lifestyle Solutions. Toya Crutchfield, co-owner and clinical director, is here to talk about this local therapy clinic. Welcome to the show, and it's really nice to meet you.
Thank you, Nancy. Thank you. It's very nice to meet you. Thank you for having me.
Absolutely. So please tell us what sets your therapeutic clinic aside from others.
Our clinic is a very unique, specialized clinic. It's one of those outpatient clinics that we're able to actually get to the source of the problem instead of just treating symptoms like most other outpatient clinics. We have a specialized spinal solutions program that is actually able to allow someone to decompress from gravity and all of life's trials and tribulations that we tend to have affect our spine in a lot of different ways. We have an aquatic program that's part of that as well. So people are allowed to get in the deep end of the pool and actually have some decompression, some traction-like activities going on. Then we do a lot of manual therapy as well, but we have the type of equipment that no one else in town has, especially in an outpatient clinic.
Okay. So the program is in addition to the aquatic and the
manual therapy.
What else do you offer?
We have a traditional clinic that we can offer any physical therapy needs for anyone whatsoever, whatever they may need. But our specialized programs are the Spinal Solutions program, and then we also are credentialed to work with people with Parkinson's disease. So we have a very specialized program for that as well.
That is very specialized, and I have a dear friend that has Parkinson's, so it's very good to know that. Obviously, there's a lot of people that would benefit from physical therapy if they've had any kind of injuries or chronic issues. But who really benefits from the program? Is it really anyone?
Everyone, because we're all compressed between gravity and the ground. And the latest statistics show that over 90% of people wind up with some arthritic condition in their spine, sometimes as early as 20 years old. So, certainly as time goes on, it starts affecting us a lot more, but, there's not one person that's exempt from that.
So would you say that people should come in general, even when they're younger, for kind of a review of where they are and what their spine looks like?
Absolutely, absolutely. Like any other thing, the earlier you can catch something, the earlier you can begin reducing the stress and compression of gravity and life's things, the things that we do, you know, for recreation, for our work, for pleasure, for whatever that may be. The sooner you can do some things to stabilize your core and work on posture and a lot of things like that, the better.
Now, is there a process for coming in to see you? Is there something that they have to go through prior to coming to visit your clinic?
Yes, absolutely. A lot of people don't realize that physical therapy is one of those things that we have some ability to treat without a doctor's prescription, but for the most part, especially if you're coming in for what we call skilled therapy, you need a prescription from your doctor, and it can say something as simple as evaluate and treat. That gets you in the door for that. And then there's also a process to go through to verify your insurance and all of that stuff. So we are able to you know, take people's information, get them verified, get the doctor's script for them if they need that, and get them in as soon as possible. And then they come in for an evaluation. At that evaluation, we can determine all the things that they may or may not need, because it's their therapy. It's not my therapy. I'm just part of that team. So.
So if someone wanted to come in, just in general, like we were speaking about earlier, just to kind of get an idea of where their baseline is with you, that's not something that they need a doctor's prescription for?
Not necessarily, no. We tend to refer to that as an assessment. So if someone wanted to come in and have a 10-minute assessment to determine where they are, you know, in the big scheme of things, we can do that. And then if they're an appropriate candidate at that point, then we would go through the same process I just said a few minutes ago.
Okay. Now your clinic's located in Bradenton.
It's located in Bradenton.
And you've been there just over a year?
Not quite a year. We opened in April of last year.
Okay, and where are you located, Toya?
We're located on Cortez Road. It's 4702 Cortez Road West. It's actually right across the street from Aldi's grocery store. Most people that live in that area know where that grocery store is. So we're a freestanding facility. It's a 9,000 square foot facility. So we've got a lot of room to do what we need to do.
And how many therapists do you have on your team currently?
Right now, I'm the only physical therapist there, and I have a PTA, a physical therapy assistant, that works with me. And then I have 2 rehab techs, and my right arm, my office manager, Jameson, is there with me as well.
Couldn't do without him.
Yes, couldn't do it without him, or Katie is another person who helps me out tremendously. So, you know, we're still growing, we're young, you know, haven't been in business a year yet, but
and tell me about the success rate that you've had for this short time. What kind of progress have you seen in patients that you've taken care of?
I couldn't wait for that question. Great success, tremendous success, to the point that when a person does their part, because we can't do it alone, the person has to take responsibility for a lot of things that they've got to do, and possibly some lifestyle changes as well to get their goals met. But when they do their part, they're compliant with the program. 80 to 90% of those people never have to have surgery, and 80 to 90% of those people never have to have another spinal injection.
Wow.
So tremendous, tremendous results.
So people should come and see you before they go to that type of extreme where they might have to have surgery.
Absolutely.
It's always better to come see.
Absolutely. You know, when you think about it, even the things we do in our life at work, everything's in front of us. You know, we're all compressed between gravity and the ground, so we always tend to bend forward.
Yes.
We get into that forward flex posture, and the further forward we go, the more pressure we put on our disc. And the more pressure that gets put on the disc, the more they start, you know, herniating, protruding, bulging, whatever it may be. And then you start getting into a situation where we've got pressure on a nerve.
Yeah.
So
and then you really need to take care of yourself.
Then you really need to do it.
Well, it's been a pleasure meeting you today,
well, thank you
and
so
I look
much.
forward to having you back in the studio really soon.
I can't wait. Thank you, Nancy.
Thank you. Aging Gracefully will return after the break, so please stay tuned. We welcome back Dr. Terry Dees to continue our discussion on weight loss and how the customized weight loss program can help you keep weight off. Thank you for being back. Nice to see you again.
Nice to see you. Thank you for having me back.
Great. It's always good to start with a little foundation again. So can you tell us how you got started with your customized weight loss program?
Absolutely. Well, I've been in practice for 16 years, and I'm a natural health physician, so our focus has been clinical nutrition, functional medicine, chiropractic and rehabilitation, and my passion has always been weight loss. We ran a program over the last number of years where we always help people with getting healthier and doing it for the right reasons, for long-term health benefits. Because when people are just trying to get healthy, to look better in a bikini or something like that, it gets hard to maintain it for the long term. And we really focused in on our customized weight loss plan over the last year.
Okay. Now, and it's about making small life changes and gradual things. Can you give us an example of what someone's customized program might look like?
Absolutely. So a typical patient for us is someone who's done a big box plan in the past. They've lost some weight, they've gained it all back. It's someone that wants to lose the weight quickly, naturally, in a very healthy way, and learn how to reset their metabolism to maintain it for the long term. So it's funny because people will call my office and speak to my assistant and say, well, can you tell me about the details of the program and how it works? And it truly is customized for each person, because what you might need for your health is completely different from what the next person needs. So we focus on whole food nutrition. We sit down knee to knee, eye to eye, and figure out where they are with their health, what high-grade nutraceuticals would benefit them to help support their body systems, to put their health in the best position possible, to help their body burn fat in the fastest way, the healthiest way. And we average men typically lose about a pound a day, and women lose anywhere about half a pound to a pound a day.
That's amazing.
It's incredible. And our demographic we work with most commonly is 65 to 85. So we're doing this with people, not 30-year-olds that have super high revved metabolisms and great hormones. So we're addressing hormonal issues, we're addressing metabolism issues, we're addressing thyroid, we're addressing detox, and we're creating a custom plan to help those people without drugs, without surgery, without exercise, get to a better level of health. And then I think it's as important for people to get the weight off as it is to learn how to reset their metabolism to keep it off.
Absolutely.
Because especially as you get older, the more you yo-yo up and down with your weight, the harder it becomes on your health.
Absolutely. There's a lot of health problems that it causes. I know. I've been there, and I think we've both talked about it, that we've both lost a significant amount of weight, and that's not anything that you want to see as we grow older.
Oh yeah, and it's hard on you emotionally too if you've lost the weight and you got back into the little clothes, and then all of a sudden you're creeping up your sizes of clothes. We build into our program a back end of lifetime support. So if things start to go south, I tell our patients, you gain back 5 to 10 pounds, you call me right away.
Absolutely.
And we'll have a come to Jesus meeting and we'll figure out how to course correct. Because 5 to 10, if you catch it, you can course correct. It starts going 15, 20, 25, 30. We have people, 60, 70. Well, then we got to start over from the beginning. And that gets tougher and tougher as you get older.
It does. Now, is there anything on your program that someone is not allowed to have?
Yeah, and that varies from person to person. So, it truly is customized of how we set things out. And knowing where people start with their health, what they've got going on, really helps a lot to customize that plan for every person. So, there probably 80% of people fall into a typical plan, but there's always those exceptions that we have to, work with to help them get the results that they want to get.
Okay, so again, now, for example, I enjoy a glass of wine. Is it something that I can have on the program, or is it something that maybe later on in the program I can incorporate back into it?
That's an excellent question. I find in this part of Florida, wine is like an extra food group. So that's a question we get a lot from people. Typically, I give people the lowest sugar cocktail that you can make that won't affect your metabolism and keeps your insulin very stable. So initially, when we're trying to, we call it a rehab phase, trying to really lose the weight, that we limit the alcohol in that phase. But as we move on to the later stages is where we can introduce, so that eventually we get to the point for people when they're in a maintenance phase, that 80% of the time they're eating a healthy diet, 20% of the time they're enjoying their life with food.
Awesome.
So they have that as a flexibility.
Okay, so that's basically how you help people incorporate into how to keep the weight off once they've lost it.
Exactly. Yes, we do a structured plan to get the weight off and can do it very quickly, very healthy, and then teach how to maintain and reintroduce so you don't regain.
Okay, and I understand you have another success story that you'd like to share with us today.
This is a lady, Lori, that we worked with. Great lady, busy in the workforce and didn't have a lot of extra time to pour into training and different things to try and get fit. She lost almost 20 pounds in 40 days, a huge amount of body fat. You can just tell in her photos that just the definition that came back was great. And we did it without exercise. 80% of your fitness is nutrition. And she's done phenomenally well. And her friends and her coworkers are just dazzled by her success. And we're
I'm sure
super proud of her.
Very inspiring. Very inspiring story. Now, you have something special for our viewers again today. Tell us about what this special offer is.
Yes, we want to give the viewers an opportunity that if you want to sit down to have a conversation about if our program could be a good fit for you, we want to give you that opportunity to do that. So we're going to give a chance for the first 20 callers. We did more than that in the past, but we're very busy, so I have to limit down the number.
Great.
But the first 20 callers that we do a free, no obligation consultation.
Okay, that's great. Please take advantage of this. If you've ever wondered what the customized weight loss program is, this is the time to do it. So thank you so much for being here again. Nice to see you as always.
Nice to see you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snnTV.com under programming. See you next Saturday and Sunday at noon.